Ever pondered about the parvovirus in dogs? In the vast universe of canine health, few ailments incite as much fear and concern as this deadly disease. Officially referred to as canine parvovirus type 2, the parvovirus is a highly transmittable infection that predominantly targets our beloved canine companions, with a particular preference for the vulnerable. This nefarious intruder is infamous for its destructive capabilities, primarily targeting the digestive systems of our precious pets. It holds a terrifying potential to wreak substantial damage on the gastrointestinal tract, leading to severe medical symptoms which include intense vomiting, bloody diarrhea, and in many cases, results in dangerous levels of dehydration which may prove fatal if not promptly addressed. The implications of such symptoms are dire, with the risk of death being significantly amplified if professional veterinary intervention is not sought urgently. But where does this ruthless, microscopic predator lie in wait for its unsuspecting victims? The answer is quite simply everywhere. The parvovirus is a global inhabitant, with no specific preference for its residential location. It's equally in the hustle and bustle of a busy park, as it is nestled in the tranquility of your own backyard. Its ubiquity is part of what makes it so dangerous. Unfortunately, the parvovirus can potentially be found in any place frequented by dogs. Transmission typically occurs via direct between dogs, as well as through contact with infected feces. This includes activities such as sniffing, licking, or even ingestion of infected matter. What's more, the virus is remarkably hardy, able to survive in the environment for prolonged periods, further increasing its chances of finding new hosts. It's often spread through direct dog-to-dog contact, and by sniffing, licking, or consuming infected feces. Now, you might think, my dog isn't in contact with other dogs that much, so it's safe, right? Wrong. This tenacious virus can live on surfaces for months, even years, if the conditions are right. It can hitch a ride on shoes, clothes, and other objects, bringing it straight into your home. So, you've got an idea of what the parvovirus is and where it can be found. Now let's talk about treatment options. If your dog contracts parvo, immediate veterinary care is essential. Time is of the essence here. There are two main treatment options. The first is hospitalization. In this scenario, your dog will receive round-the-clock care, including intravenous fluids, antibiotics, and medication to control vomiting. The second option is at-home care with medication from your vet. This route is less intensive and relies on you to administer medication and provide supportive care. It's a viable option, but requires a significant commitment and vigilance on your part. Survival rates vary depending on the age of the dog and the treatment it receives. Puppies under 6 months old are the most vulnerable due to their immature immune systems. With prompt and aggressive treatment, survival rates can be as high as 80 to 90%. So, to summarize, the parvovirus is a formidable foe, but with prompt veterinary care, the odds can be tipped in your dog's favor. It's found globally, can live on surfaces for years, and is highly contagious. Treatment options include hospitalization or at-home care with medication from your vet. And the survival rates can be quite high, especially with early intervention. Remember, the best defense against the parvovirus is prevention. Regular vaccinations and good hygiene practices can go a long way in keeping this deadly disease at bay. Before we wrap up, make sure you hit that like button and subscribe for more insights into canine health and well-being. Stay informed, stay vigilant, and keep your furry friends safe. Until next time.